In the words of Jim Rohn, take care of your body. It is the only place you have to live in. Today, we shall be examining a health condition that the fate or outcome is on the vigilance of the patient. Breast cancer. Yes, breast cancer. Better You Today identifies with a global drive to increase awareness and sensitization aimed at reducing mortality and morbidity, reducing the condition to the barest minimum. My name is Yetunde Jayola. We will go on a short break, after which our mini documentary comes up. Please stay tuned.
Breast cancer, also referred to as breast carcinoma, occurs when breast cells mutate and become cancerous cells that multiply and form tumors. Breast cancer typically affects females, women aged 50 and older, but it may also affect men and younger women. The cause of what triggers breast cells to mutate and become cancerous is still unknown. However, research shows that there are several risk factors that may increase the chances of developing breast cancer. These include age, being 55 years or older, sex. Women are more likely to develop the condition than men. Family history. If your parents, siblings, children, or other close relatives have breast cancer, you are at risk of developing the disease. Genetics. Up to 15% of people with breast cancer develop the disease because they have inherited genetic mutations. The most common genetic mutations involve BRCA1 and BRCA2 genes. Smoking. Tobacco use has been linked to many different types of cancer, including breast cancer. Drinking alcohol beverages. Research shows that drinking beverages that contain alcohol may increase breast cancer risk. Obesity. This predisposes the sufferer to breast cancer. Radiation exposure. If you have had prior radiation therapy, especially to your head, neck, or chest, you are more likely to develop breast cancer. Hormone replacement therapy. People who use hormone replacement therapy, HRT, have a high risk of being diagnosed with the condition. Menstrual history. The odds of developing breast cancer increase if your period starts before the age of 12 and your period did not stop until you are after 55. In terms of epidemiology, among women, breast cancer is the second most common cancer after skin cancer. It is the second leading cause of death from cancer after lung cancer. Also, white women are affected by breast cancer than any other race. Breast cancer will affect 1 in 8 women in their lifetime. Men can get breast cancer too, but they only account for less than 1% of all cases. Note that breast cancer can also result from factors that you have some control over and can change, such as keeping a healthy weight and getting all recommended screening. Your action can help you to both prevent breast cancer and make it more treatable.
Eckhart Tolle says, awareness is the greatest agent for change. connecting with the awareness and sensitization drive geared towards reducing the menace of breast cancer on our communities. A sensitization program took place recently. Here is a report on how it all went.
The World Health Organization (WHO) declared the entire days in the month of October every year as Breast Cancer Awareness Month. The theme for this year is "No one should face breast cancer alone." WHO launched the Global Breast Cancer Awareness Initiative in 2021 to reduce mortality rates and save lives through three key pillars of action. These are health promotion for early detection, timely diagnosis, and comprehensive breast cancer management. It is in this vein that the Jacaranda Cancer Center, in conjunction with Lion International, organized a breast cancer awareness and sensitization seminar with the theme Close the Care Gap.
Let's teach everybody.
Resource persons harp on the imperative of early detection, urging participants to listen to their bodies and take proactive steps when necessary.
Gentle touch. You go around the breast like that. You go around the breast. And then the four quadrants, I said four quadrants, go around the floor. Upper, lower, upper here. Then the nipple. Examine it too and then squeeze it out to see whether anything is going to come out of it. Then you go on to the, what we call the armpit. The armpit. You see, there can be balls in that armpit without any lump in the breast.
Salient issues affecting the detection, treatment, and care of breast cancer, such as stigma, name-calling, ignorance, amongst others, all came to the fore in the gathering.
We need to go to the rural, urban, suburban, everywhere possible. Media, prints, people should read about it. Even a non-breastfeeding mother having nipple expressed and then there is milk coming out, that is not normal. Then people should be well taught everywhere how to do this self-breast examination. All our refined sugars, refined diets, we should be weary of them. God gave us vegetables, high fiber diets, your corn, your beans, all of those natural things should be taken naturally, not refined packaged inside cans. They are not helpful. Please, there should be decrease in intake of milk for people that have cancers.
The Breast Cancer Awareness Month is best known for its pink color. This event is an example of breast cancer advocacy organizations and non-governmental organizations partnering to conduct campaign programs to local communities.
Survival is very possible. There are already 3 million people that have survived cancer, and as much as possible, they should ensure that they take care. They should run away from herbs and make sure that as much as possible, they seek care from the healthcare professionals.
Basically, for people to understand, to have the knowledge about breast cancer, because most people think it is only when I have time or when I have the actual problem before I can actually go for checkup and all of that. But we are doing this awareness so that people can know, even before you feel anything, you can actually go for checkup. It is free. So it's free, there's free screening.
The problem with the people is that they don't want people to know they are having this thing. That's the issue. At times when some of my friends came to visit me, hello, Shane, say, it's not a big deal. So that is it.
Efforts such as this aims to support people diagnosed with breast cancer, educate people about breast cancer risk factors, encourage women to go for regular breast cancer screening at age 40 or earlier, depending on personal breast cancer risk. Fundraising for breast cancer research.
Taking breast cancer awareness to the grassroots do assist in reducing the spread, incidence, and prevalence of the disease. It is my utmost pleasure to introduce our resource person, Dr. Duromola Kende, a consultant obstetrician and gynecologist. He reveals the basic knowledge aimed at equipping Nigerians to take the right steps and adopt relevant strategies, all in the favor of good health and preventing the disease.
Breast cancer is an abnormal growth in the breast, and it's the malignant transformation, unlike those that are just what we call benign, which does not have the risk of causing death. It's very important to put so much focus on it so that such to minimize the impact of breast cancer. And October has been identified as a pink month, for the whole month to put much focus on awareness, screening, and other means whereby breast cancer can be made known. So it requires a lot of focus, a lot of attention, since it is something that can actually be prevented, and if it's identified early, can be managed. So effort should be put more on awareness. Breast cancer, just like any other cancer, there are so many that be identified as likely cause. However, what can be essential in the issue of the cause are the risk factors. The cause are just abnormal growth beyond the normal way it's supposed to be. This can happen in any other part of the body. However, for breast cancer, some factors are identified as risk factors that puts people at higher chance of developing this condition compared to other things. And essentially importantly among this is black race. Black race has been found as a risk factor. However, it is commoner in white compared to the blacks as a condition, as a disease condition. Also, particularly for those who have high body mass and the body fat, also particularly within the breast. Also among women, those who has first relative who have developed cancer, probably their sister, their mother, or even second degree relative, their cousin who develop aunt who develop breast cancer, such a woman is also at risk of developing breast cancer. Aside that, smoking has been identified as a very important risk factor for breast cancer, and also some medications have been also been identified, and one of such is contraceptive that we call progesterone contraceptive. It's also been found to be a risk factor. However, once this is stopped, the risk come back almost to nil. Breast cancer, just like many other cancerous conditions, is a condition that has a lot of significant impact in the life of a woman, the life of the family. And we know that in the family, the women are responsible for so many things within the family. So anything that has effect on the woman, particularly those who are mothers, the effect on the husband, on the children is very, very significant. And many a times, because of the fact that cancer is diagnosed late in our environment. So it takes a lot of burden on the entire family in terms of the financial cost to manage these conditions. Even when the fund is available, the expertise to manage these conditions, and also the things required in terms of the care that you go, the medications and other means of managing this condition, it has a lot of burden on such a family in managing it. And of course, the psychological effect of it cannot be underscored, because mere making pronouncement that somebody has breast cancer, it has a lot of impact on the psychological state of the woman, and this can also lead to some other effects on the family. Breast cancer, most of the time, start with some physical symptoms like breast lump that can be picked up. Some can be in form of skin rashes on the nipple, on the breast. It can even be in form of redness, change in color. It could be such a way that even the breast can get retracted inside. There are some things that can be seen that can give a clear picture that this is a breast cancer. And essentially, it is better if it's identified as a lump, which increases the chance of survival compared to when it's already started having all these symptoms, not to talk of even getting metastasized or moving to the brain, to the lung, to the bone, and to the liver. So to avoid all these complications, the best is to prevent it. So that makes screening and self-breast examination as the primary step that's been advocated. And the first is to have what we call breast self-examination. Women are encouraged that for each month, usually at the end of the week or within 1 week after completion of their menstrual cycle, they're expected to examine their breast to check for it. And it not only helps them to identify that whether there's a lump or not, it also helps them to be able to identify how their breast looks like, so that if there's going to be any difference at any point in time, they can really pick it up that, oh, this is different from the way it used to be. So that is very important. Also, another important way to also take care of this condition is to do what we call clinical breast examination, and this is done by the nurses and doctors. It's advisable for young ladies between 20 and 40 years of age to do this at least once in 3 years, while those who are 40 years and above are advised to do this at least once in a year, so as to be able to identify and pick whatever they might have missed in the course of their monthly breast self-examination. For those women who are pregnant or for women who have stopped menstruating, they can decide to choose particular dates, and that particular day of the month will be the regular time they will be doing their own breast self-examination. And beyond this, there's also provision for what we call mammogram. Mammogram is a machine that uses low-dose ion radiation, like X-ray, such a way that they will position the breast within it and be able to scan through it and give a picture of how the breast looks like. And if there's any lump, even at a very early stage, this machine can pick it up. This is advised for those who are 40 years and above. However, for those who have a family history, genetic predisposition, maybe the family mother or aunt or cousin has breast cancer, such can be asked to start their own at early period compared to others. So these are the steps that can be taken to prevent it. However, once it is diagnosed that it's breast cancer, the treatment are in stages depending on what is done. Some may require the removal of the lump once the lump is identified, and that can still preserve the breast. Another step, it can go beyond that. It might require doing surgical removal of the breast. And to be alive is better than to just die because of the breast cancer. And beyond this, some, even with the surgery, they might still benefit from what we call radiotherapy, whereby they have to use radiation to be able to destroy the remaining cancer. The same thing also with what we call chemotherapy, use of medications to be also clear off any outstanding tumor growth, that tumor that is remaining after surgery has been done. These are ways to be able to manage for those who have developed breast cancer. The World Health Organization has made it an important step to make sure that those who have breast cancer are not left alone. They are to be cared for. So the first important thing is to ensure that support is given to people that have been diagnosed with breast cancer. And for those who have had this condition, it's advisable that as much as possible, they should be able to seek medical attention early. This is not the time to start thinking we're going to start using some herbal medication or some other means of care, because it has been shown, evidence has shown that medical care and surgical intervention at early stage can still provide 100% survival for those who are diagnosed at early stage. Even when it's diagnosed at advanced stage, it is advised that such should still seek medical care, whereby proper care, proper diagnosis, and as much as possible to reduce the impact of that condition on them, so you should seek medical care, which is the most important thing when it comes to diagnosis of breast cancer, just like any other cancer. However, for those who are at risk of breast cancer, it's advisable that they should start doing screening. They should seek medical advice early, so that if at any point in time they're going to develop this condition, it can really be picked up, and then the chance of survival will be very high in them. And also, for the family of those who have had people that have been diagnosed with breast cancer, we emphasize that we should not leave them alone. We should provide the support and care that they need, so that at the end of the day, they'll be able to live a life that is as much as possible quality life, even with the condition.
If you are just tuning in, you're watching Better You Today, coming to you from the stables of the Nigerian Television Authority, NTA. It is now time to burn some calories. Exercise not only changes your body, it changes your mind, your attitude, and your mood. Let's get to it.
Before you start any exercise routine, warm-up is essential. So we just do this. This. 5 to 10 times. Okay. You find that when you do that, you are ready. Gets your body ready from in alertness to get you alert mentally and physically. So we'll just do a few leg raises. We'll do 10 repetitions. We'll do it 3 times and take little breaks if you so desire. Okay. 2 legs punches, right?
According to Theophractus, time is the most valuable thing a man can spend. We most sincerely appreciate you for spending your precious time with us on this episode of Better You Today. Remember, you can watch this as well as previous editions of the program via our YouTube channel displayed on your screen. I remain Yetunde Jayola. Till we come your way again next time, regular self-breast examination saves life. Eternal vigilance is the price of liberty. Bye for now.